So a little bit more about what to discuss at your vet visit. This one's more specific for the cat. Most of my prior videos are about dogs and cats, but I really speak about dogs more often than anything. Everything I've said in the prior video is about what you need to be discussing and doing at the vet clinic, the blood work and the information about the reminder cards and watching the pet at home and looking for any changes and being proactive about your pet's health when you're in the annual vet visit. That all absolutely applies. But there are a few specific things about cats that we haven't discussed yet. So for your cat visit, here's a few little extra pieces of information. First of all, the carrier, the kitty carrier. Most people leave this in the garage or the basement or somewhere out of sight, out of mind, and you only bring it out once a year to put the cat in to take it to the vet. And it smells like the garage, or it smells like the basement, or it's full of cobwebs. It's just your cat doesn't want to go in there. So you start off, with a very negative experience with the cat, trying to get it into the carrier before you even take it to the vet, which is often going to be a negative experience. So, simple thing you can do is keep the carrier out basically year round. Put it beside the food and water bowl or beside the litter box. A lot of people take the top off the carrier because most of them come in half. Take the top off, and that can be the cat's bed right beside the food and water, the cat's safe place to lay. You can leave the top on it and the gate open or remove the gate. And it's a safe little hiding place for your cat. Cats like hiding places and like to be under things and like to feel like they have some amount of shelter or protection instead of being completely out in the open and exposed. So having the carrier out and available all the time may be something your cat likes. And when it is time to go to the vet or go somewhere else or travel or whatever, the cat's not as freaked out and scared of the carrier. Okay, so make the carrier a happy place year round so it's not a frightening thing. At the vet clinic, when you get there, hopefully your vet is already doing these things and there aren't dogs sniffing around your cat carrier. Hopefully your vet's doing things like making a separate area, cat waiting room versus dog waiting room, or a quiet area or something to where your cat's not freaked out about the dogs running up and sniffing the carrier on the floor. Don't let that happen. Keep the carrier in your lap, wait in the car till it's your turn, or have a separate waiting area if your vet does that. Another thing about cats is they don't like to be handled. Obviously, cats are their own kind of thing. So sometimes your cat has to be sedated for a blood draw. Well, we'd rather not have it that way. So just like I talked about with puppies and kittens, handle your cat often. Potentially take your cat outside for walks if you and your cat can handle it. If you have a properly fitting harness and you're comfortable and confident with this, even taking your cat out on the porch for fresh air is a good thing. But putting them on a leash or a harness or putting them in their carrier and going for a little walk or a short car ride now and then, do these things so that when it comes time for the vet visit, it's not the first time they've ever been for a car ride, or it's not the only time once a year they go for a car ride. Let them be more used to it and accustomed to it. So do it more often. And in theory, that'll make the trip to the vet less stressful because they're already used to so many of these things, the carrier and the car ride and being out of the house. All right. So as I said when I started, all the things apply that we talked about in prior videos about the value of blood work and your annual visit. Doesn't have to be about the VACCINES. But there are a few things about cats that are even more important than they are in dogs. One of the topics is the blood work. Cats are well known for having kidney problems later in life. So the annual blood work we've talked about to look at the kidney values and a urine sample that gets even more information about how well the kidneys are working. This is pretty important for your cat. You should do this every year. You should do it for your dog too, but it's even a tiny bit more important for your cat. And you want to look at things closely. The reason I like to do it every year, and I may have said this before, is a lot of times their numbers will be in the normal range, but every year they step up a few points to where now at the old age, they're still in the normal range, but they're at the very tip top of normal range. And they didn't used to be there. They used to be in the lower end of normal range. That means things are getting worse. In another year or two, they're going to be outside of normal range where they're technically a problem. If you're following that every year and you see those results getting higher and higher and closer to abnormal, but before they become abnormal, well, that's what we do as holistic vets. We want to try to fix those things before they become a physical problem. And even your Western trained vet, if they look back at the blood work over the years and they see this trend, even though it's still normal, but it's trending towards abnormal, they'll usually act on that in some way, even if it's with crappy food that we don't agree with, but they'll at least try to act on it, and that's a good thing. All right. The other big main thing I think at the vet visit is the spay neuter topic. So I've talked a little bit before, and I'll probably talk a lot more later in more detail about we spay and neuter cats and dogs for our own human society benefit. It's a terrible thing to do to the animal. Okay, we're removing their testicles or their ovaries and uterus, and that just messes up their hormones and their growth and their immune system and all sorts of stuff, and it's a bad thing. But we do it because we can't properly train the animals and keep them from being pregnant, so we do it for our own convenience. However, cats are a little different. You just can't live with an unneutered, intact male cat. They'll mark and spray everything, and it stinks and it's nasty, and you can't live with that. So your male cat's going to have to be neutered. The best you can do is wait until he's 6 or 7 months old. Wait as long as possible before he starts making stinky urine before you do it. Don't do it when he's really young. Wait until you have to do it. And then female cats, even indoors, there's there's a scene in Jurassic Park where Jeff Goldblum's character says, "Nature or life, either life or nature finds a way." Female cats will get pregnant. Okay, I don't like that we remove their hormones and their body parts, but they'll get pregnant. So you've got to spay and neuter your cats. You just want to wait until as long as possible, which is usually around 6 or 7 months of age. Don't do it at 8 weeks of age at the shelter. Try to wait. But it's not like dogs where you can train them properly and contain them properly and let them keep their hormones their whole life. That's just a different thing with cats. So that's unfortunate, but it's the way it is. So those are kind of the main differences is, trying to make it not as scary of an experience for your cat by getting them used to some of these things that are going to happen when they go for a car ride. And the spay neuter issue is just a bummer, but that's the way it is. Okay, more later. Thanks. Bye.